Worried about surgery? Listen to the facts and ease your mind. There's a long list of common questions we receive about bariatric surgery. Some of the most common questions would be, number one, is it safe? A lot of patients have not even investigated weight loss surgery because they know of a remote history of like a family member 20 years ago that had a bad experience with weight loss surgery. Weight loss surgery now is one of the safest operations that I perform. We've perfected our techniques so well with laparoscopic or robotic surgery that patients have such good outcomes that safety is no longer a major concern with weight loss surgery. Patients will often ask something like their risk of dying, and the risk of death with weight loss surgery is well less than 1%, which is the same safety profile of most of the other operations that we perform as general surgeons as well. Another very common question is, will I be hungry all the time? Patients are frequently concerned that with the weight loss, they will feel hungry during their weight loss journey. And the answer is no. The way weight loss surgery works is really twofold. Number one, it gives you a restriction of how much you can eat. Number two, it gives you the feeling of fullness from an array of hormonal changes that occur after surgery. And this goes back to something we call the set point theory, where it lowers the set point of your body to a new level where it's at a new comfort level, where your body no longer feels hungry at a higher weight. And so by adjusting the hormones and the amount that you can eat, you get long-term weight loss that's comfortable where you're not struggling to eat all the time. Patients often have concerns that I'm worried I'm gonna be hungry and it's gonna be miserable. Well, in fact, after weight loss surgery, most patients aren't hungry at all, and they actually have to remind themselves that it's mealtime. And that's one of the ways that weight loss surgery is such a durable answer for weight loss, is that patients aren't struggling with appetite and hunger pains all the time. So patients also have anxiety about nutritional deficiencies that they hear about with weight loss surgery. So nutritional deficiencies are generally thought of as a byproduct of some of what we call malabsorptive surgeries. So the restrictive surgeries, which is the sleeve gastrectomy, we remove part of the stomach, and by doing that, we don't really create malabsorption, meaning you absorb all your normal nutrients. So there's no malabsorptive process where you're not absorbing vitamins or iron or folate or calcium. Everything gets absorbed because it goes down its normal digestive pathway. So we don't generally see nutritional deficiencies with the sleeve gastrectomy. Some of the other operations, there's two primarily done right now in the United States, the gastric bypass and the duodenal switch. With those, you do have to have special vitamin supplements because you're bypassing a certain portion of your intestines. And so you'll need to take special vitamin supplements and have your vitamin levels checked regularly with your clinician to make sure that you don't develop deficiencies. But as long as you stay on target with taking the vitamins, then the risk of deficiencies are extremely low. Another very common question that patients ask is, what about the excess skin after surgery? There's multiple factors that contribute to excess skin. Patients that have a lot of weight to lose have a higher risk of excess skin. Most patients don't have an issue with this. This is more of a problem I feel like there's a lot of anxiety about, but in the end, it's a lot less common than patients are actually fearful of. There's some factors involved with excess skin. Number one would be your skin elasticity. It would be a patient's age. The older the age, the less elasticity of the skin. The eating in a well-balanced diet, exercise, and keeping a diet that's high in protein. I like resistance training. It helps the elasticity of the skin. And we definitely encourage that after surgery, starting at about 2 weeks and staying with that program. And then avoiding smoking. Smoking plays a big role in skin health. Patients with a history of smoking do have a higher risk of having excess skin after surgery. And that's why it's so important that we stop smoking for surgery as part of your lifestyle change. Follow us for more patient stories and health advice.